Nations people with us who are joining today as well. I'd also like to acknowledge those on the call today with lived experience of stroke and the contribution that they make, particularly to the Stroke CRE, but to improving stroke outcomes throughout Australia and also internationally as well. So it's with great pleasure to introduce Associate Professor Liz Lynch. Many of you will know Liz from her work in stroke rehabilitation. Liz is a Matthew Flinders Fellow at the Flinders University in South Australia, and I'll hand over to Liz to kick us off just now. Thanks so much, Liz. Welcome.
Thank you very much. So thanks for the opportunity to speak about something I'm having a lot of fun doing, which is with the work that I do, is partnering with people with lived experience of stroke. So I'll speak first and Aid will speak second, and hopefully it is a seamless transition from one presentation to the next. So just acknowledging again, thank you. Everything that I'm presenting here has been developed in collaboration with people with lived experience of stroke, which has really helped me on my learning and my experiences as a researcher. So thanking everyone who's ever worked with me, who's helped me learn doing what I do. So one of the things that I like to do when I'm trying something new is think about how that would affect me. So if we were going to have a national policy agenda item that was about researcher funding or how researchers should be trained, and so then a policy, a project team gets made of people who actually aren't researchers. So they think, well, we know about research. So we're policy makers and we're health service administrators. So we know what researchers should be doing. We probably know how to set things up for them. But we better probably check in. So how about we do some surveys or focus groups with researchers and find out what they think. And then go back so the project team takes that information from the researchers and makes decisions and then tells the researchers what they've decided. As a researcher, that would make me really cross. I would think I would much rather be involved as part of the team. I'd want to be involved in the discussions and I'd want to be included in the decision making, knowing well that I might not be able to get my way. Maybe decisions will be made that I would go a different way, but at least I'd have been there part of that process. And so that's why we say, well, if we're doing research about stroke, we should be having people who've lived experience of stroke at the table. And so what happens when key individuals aren't involved? So as a woman, this was something that I thought was in 2013 when we had a minister for women who was a man. And so I've just taken headlines from newspapers. And so the target population, so if, he also took on responsibility for Indigenous affairs as a white man, which if I just go for the 50% of the population that he was representing who were women, there was a marked disengagement from the target population with lots of media outcry. And then the obviously concern then is that if you're having other people represent your viewpoints, they might not achieve outcomes that are important to you. People might make assumptions about what you want that aren't exactly what you want. And we saw this as a minister for women saying the carbon tax repeal was a great achievement. And as a woman, I think most people would say that wasn't, whether you're a woman or not, most people can say that wasn't really hitting the spot. So that's why we should be having people who are most involved making those decisions. So when we're talking about involvement in research, we'd be talking about working with people, not on people, not for people. And so I think it was around the 1980s, it really arose from the disability community about nothing about us without us. So if there's any research involving a population, they should be part of that conversation and making part of those decisions. In working this way, there's real explicit acknowledgement that having lived experience at the table has real value. It can really increase the robustness of the research. It can increase the impact of the research, the relevance. And as part of involvement, there is a real obvious assumption that not only will people with lived experience be at the table, but their perspectives will be incorporated into your research. So, not just sitting at the table, but actually listening and learning and trying to incorporate those perspectives. And so why is this important? So you can learn different perspectives from people. So with this image, do you see two white faces, or do you see one black bars? Having people with lived experience can help you make sure that what you're communicating is relevant and understandable to the target population. So for instance, I'm a physiotherapist, I would probably have a really high degree of health literacy, and we need to make sure that we're not making assumptions about what people know already, not using language they don't understand or concepts they have that are new to them that need further explaining. Obviously, in terms of research, we want our research to be relevant, and if we haven't touched base with the community who's most going to be affected by that, we don't actually know how relevant the research will be. People with lived experience can provide expert advice. If you're doing a trial involving human participants, people who lived that life can let you know, well, this questionnaire, it's too long. This way of collecting your data is really tricky. This is how you might recruit your participants. So there's all different sorts of advice you can have that is really just helping you get your research right, as well as you can obviously do a lot more in-depth involvement and incorporate perspectives into your method, into your whole rationale for your research as well. And obviously in Australia, these days you can't actually get funded unless you've demonstrating really holistic involvement of people with lived experience in your projects. NHMRC calls this consumer engagement, but in most people living with chronic health conditions or living with different health conditions prefer to be referred to as people with lived experience. And we've got that from research we've done here in Australia. So people with lived experience can be involved throughout the research cycle. So this is a figure that I've adapted from the NHMRC research life cycle and pathway to impact. So you can ask people with lived experience to help conceive the project. So they might actually come to you with a research project, or you might have a project that you want to touch base and check. Is this question a good question? People can be involved in helping you design your intervention. You can touch base about study design. So a woman I worked with, I didn't work with her, I listened to her speak, who worked in cancer research. She wanted to do like a randomized controlled trial, and people living with cancer said, we aren't okay with a control group. So we want everyone who signs up to this research to be getting the intervention, even if we don't know if it works or not. And so she had a rationale then to be doing a before and after trial, because that was a really strong message that she was getting from her lived experience advisors. People with lived experience can help you choose your outcome measures. They can say, well, this is the thing that's most important to me, or they can say, this outcome measure, I understand, this is less of a burden, those sorts of things. And they can help you advise on how you collect your data. More and more these days, if I'm doing interviews, any sort of qualitative data collection, I think the data that is collected with people with lived experience as research assistants is way more robust than when not. So people with lived experience can help you collect your data. They can help you train your staff. If you're doing an intervention, being trained by someone who can say, be mindful of this, is really helpful. And they can definitely help, a really common, quite a light touch way, a nice entryway is you can have your research materials. So like your recruitment flyers or your information sheets, having them checked by a person with lived experience to check that it's appropriate. Having people support data analysis, I think, is important. So even if you're doing a clinical trial where it's very number crunchy statistical analysis, that needs to be done by the statistical analysis experts, but then interpreting what that means. What does that mean to someone living with the condition, I think, is how they can support data analysis there. If you're doing qualitative data analysis, I've worked quite a lot with people who help me either sometimes code the data, but otherwise, if I've done the coding, then touching base and saying, this is what I'm thinking, does this make sense to you? And having that sort of validation. And the other really important one for disseminating your research, particularly if you're wanting to get the message out to community, is consult with people with lived experience about how that should be done. Having people with lived experience support your dissemination of your research to policymakers is very, very powerful. I think policymakers they would listen to someone who's living with a condition more so than a researcher or a health professional often, because it's you know, the meaning is so much more real. There's lots of different words to describe how, oh, I forgot to start my timer. There's lots of different words to describe what it is that we're meaning when we're talking about involving people with lived experience. So quite often you'll see things about co-design or co-production. Internationally, people will talk about patient-public involvement, patient partnership. That's a big one in Canada. So all these things are different ways of involving people with lived experience. So this is the language we use in Australia. There's different language. Engagement and involvement are used differently in Canada than they are here. So that is quite confusing. And so this is the spectrum of how people with lived experience can be involved in a research project. So the first one is where you have participants. So this is when people who sign up to your research project, they provide informed consent and they contribute their data to the research project. So this quite often is things like a trial participant who receives whatever intervention you're doing and collects data before and after. The other thing to be really mindful of is that people that are participating in focus groups or interviews, and you are collecting data from them, they're participants. So they're not being involved in a consultation. They're not being involved in your research. They're contributing data. So simply running a focus group, I mean, that's good. It's good to hear what people want and need, but that's looking at people with a participant. They have no power. They have no decision-making. They have no decision-making power in your research project. So that's not being involved in your research. That's you're being a participant. Engaging with research. So this is language that I've just pulled from the Australian Clinical Trials Alliance. So this is when other frameworks, you'll often see this being informing, when information is shared with the community so they're better informed about the research. So they're interested in your research, they want to know about your research, but that's not involvement. That's just having a look and seeing what's out there. So these next three are what I would call involvement. And so you can consult with people with lived experience. So this might be doing a one-off consultation. It might be having an advisory group. There's different ways that you can do consultations. An individual or a group of people often are responsible for discrete tasks. So they might be checking your study materials for, is this understandable? Is this appropriate? Is this catchy? Will people be attracted to this? They can advise on community preferences. And certainly you can do work to do, and it can be quite a long consultation process if you're wanting some advice on your intervention design. So when you're working with consultants, you're not actually gathering data from people. People are providing some insight and some knowledge into how your team will make decisions. So the consultants often aren't making decisions, but they're providing kind of intellectual input into your project. So for this reason, you don't need ethics if you're consulting with people, but you should be offering remuneration because you are consulting these people for their expertise. Very similar, when you're working in this level, it's very similar to going to someone for research advice. I think what we're very familiar with is you might be going to a statistician for advice, not to do your stats in this instance, but to go, is this a solid idea? And the statistician can say, no, might need to go and do something, go and read a book. Statistician's not a good advice because you're not a good example because you'll often have them on your team. But going to someone for discrete advice about a particular aspect is what you're doing with the consultant. And that's why you don't need ethics, but you should be paying, or you should be offering some form of remuneration. It's not always money. Next level up in terms of more involvement, more power, is when you partner with people. And so this could be with organisations or individuals. Typically on a project, this is when you're having people as co-investigators. And when you're doing partnering with people, they are contributing their expertise, they're sharing their power, and they're being part of making decisions. So they're part of the team. just like anyone else on the team. When you're working this way, and Ada will go into this in a lot more detail, there's a way to do this, because it might, if you haven't done it before or your team is unfamiliar with this, there are particular things to look out for. Things to think about are the capacity of all team members. So in terms of the people with lived experience, as well as the academic researchers, looking at entrenched power dynamics. I think particularly in health work, we come from the perspective where we were all knowing kind of health professionals and delivering information and education and therapies to people who've had a stroke, and so there is this quite an entrenched power differential, and so it's evening that up and putting steps in place to make sure that everyone is even at the table, and putting things in terms of the way the team will work. And then the highest level of involvement is when people with lived experience come up with the project themselves and are supported by the academic researchers. And so we see this in things like the MRFF calls, where different groups of people have identified the research priorities, and then people can apply to do that research. And we see it often in Aboriginal health, where the Aboriginal community identifies what their research needs to be, and there'll be a team of Indigenous researchers plus or minus support from non-Indigenous researchers who are supporting the project. So in terms of one example, this is a case study of partnership, where we had academic researchers, health professionals, and people with lived experience working together in partnership. So in 2020, as part of the CRE in stroke rehabilitation and recovery, we ran a diversity inclusion workshop in Melbourne. And so this was a face-to-face workshop. We had a group that was coordinating this day, which again had people with lived experience, academics, health professionals there in the room. Initially, when we were planning this, we weren't quite sure whether or not we were talking about how to do better recruitment to make sure that we weren't excluding, for instance, people with aphasia from research trials. And then it kind of morphed into, no, this was, it started off a bit like that, as well as how to make sure that people are being empowered and supported to have their voice heard. We had lots of presentations from people with lived experience and people from different academic and professional backgrounds. And at the end of this day, and it was all about how can we work together, how can we make sure that the research is valuable to the community of people who are living with the effects of stroke. And at the end of the day, it became very clear that what we needed was better support to work together. Like, how do we do this? And so Julie Bernhardt, who headed up the CRE, had a discussion with Sharon McGowan, who was the head of Stroke Foundation at that point. And together, Stroke Foundation and the CRE put money together to develop resources to support academic researchers to work with people with lived experience, and for people with lived experience to work with the university kind of based researchers. So we had a work group with survivors of stroke, again, and someone from Stroke Foundation, as well as researchers. We drafted up resources based on the discussions we'd had at that workshop, and then building on our experience. So Kira Shiggins, who's there in the picture, she had done her PhD in Involve, which was a patient public involvement group in the UK. And so she probably, I think in Australia, we were lagging a bit behind the UK at that point. So she had a lot of knowledge that she was able to contribute to our team, as well as all our experiences working collaboratively. We drafted up resources. Then we sent those draft resources out to everyone who'd been to the workshop. And then, so that was our level of consultation. We asked people to review them. Have we missed anything? Does this make sense to you guys? And then we finalised the resources. And so here are some papers. Caleb can send these around later if you want. So we've just, as of this week, had our paper accepted about how we develop the learning modules. So we do have preprints available, which is there on the QR code. So that's the whole process of the co-design, co-production of those learning modules. We have a tutorial paper that Aid's going to tell you the crux of in the next presentation. And I'm not sure if Aid has these on his slides, but I'm just putting them here anyway. So these are the learning modules. So we have separate modules for academic researchers and a separate module for people with lived experience. And that is me done, if I can stop sharing.
That's terrific. Thanks so much, Liz. That was really fantastic. We'll move swiftly on. If anyone has any questions as well, just a reminder to pop them in the Q&A chat for our discussion towards the end. But it's my pleasure to introduce our next speaker, who is Aid O'Malley. Many of you may know Aid and might have bumped into him at a stroke conference or two, but I did a bit of an online Google for Aid's bio just to see what was floating around online. And just a surprise to me that he's involved in the a founding member of the Stroke Foundation's Consumer Council back in 2010. So a long history here with stroke in Australia. And it has been presenting at many conferences in the past as well. And now as a published author as well on a few papers as well. So congratulations, Aid, too. I'll hand over to you to share your experience around top tips. Thanks very much.
Thanks, Caleb. Yes, published author, and I got a promotion today, everybody. I got an email. I'm now Dr. O'Malley. It's just as you get a doctorate by email. So I'm now a published researcher and a doctor as well. Look, before I kick off, I'd just like to, for those new to this, for those in the call that are wondering, I mean, the stroke community and the research community have come on a massive journey in the 15 odd years that I've been around it. And we collectively should all give ourselves a pat on the back. Don't be afraid. I would encourage you to be curious if you're wanting to get involved, because we have come such a long way. And stroke is the stroke community is a bit of a leader, certainly in Australia and certainly within the stroke world in terms of engaging with people with lived experience. So well done. And I encourage you to go on and do it. So these top tips, these came out of working with Liz and others, and this was part of the training modules that we developed for people with lived experience and for researchers. And I'd like to acknowledge Julie Bernhardt and the previous CRE. I remember it was my last meeting on the Consumer Council. And this woman who I'd never met, never heard of, never seen, came in and was talking about wanting to work with people with lived experience. And as I said, it was my last meeting, and Sharon McGowan was then the Stroke Foundation CEO. And I said, look, Sharon, I realise it's my last meeting and my association ends, but this is really interesting to me and I'd like to be involved. And so I got on board early with this journey. And Julie really demonstrated warmly what working together looks like. I was challenged, I was stretched, I was developed. I was certainly a different person at the end than what I was at the start. And Julie really graciously worked with people with lived experience of stroke. So I want to acknowledge Julie for kicking us off to where we are today. And what we're looking at is the resources that we developed. They sit on Inform Me for researchers. They sit on Enable Me for people with lived experience. And they're, well, first of all, if you want to get Stroke Foundation money, you have to do these modules. So if you don't do these modules, you'll never get to work with me, but also you'll never get any Stroke Foundation money. So a lot of work by some really talented people collaborated to produce some fabulous resources. I'd encourage you to go and have a look at them. I know Liz has put the QR codes up. It'll take you maybe an hour of your day. It'll set you up on what good looks like when working with people with lived experience. And so here's the journal article that came out. See, I do acknowledge everybody. Liz, well done me. All of us that work together. Early on, I realized, and you'll notice some common themes in these top tips that I'm talking about. I was alone. There was all these researchy people, and there was me, and I couldn't be the sole voice of stroke. and the token bloke in the room with the token stroke in the room, as we joked about. So we brought on board Brenda Booth as well. Brenda is a very experienced, how would I describe? Lived experience expert is how I would describe Brenda. I would describe her as the elder stateswoman of stroke in Australia. So Brenda and I were the two voices of stroke and our co-researchers. We worked together to develop those resources, but also we've got these top 10 tips. And as I mentioned, you'll see some recurring themes, but you want to you guys know your team. You don't know me generally, and you want the team to last. So be clear about the roles. As you know, if you think about Liz's pyramid, am I leading or am I participating? What do you want out of me? What version of me besides the lived experience of stroke? You know, do you want me to bring strategic thinking? Do you want me to bring networking? What do you want out of me? So other than the unfortunate essential criteria of surviving a stroke, what else do you want from me? Are there people with aphasia? Are there people with sensory deficits? Are there people with cognitive deficits? What representation of stroke? What other skills, as I mentioned, besides, I had a life prior to a stroke. Maybe I'm a lawyer, maybe I'm an accountant, maybe I'm a statistician, don't know. But as I said, so what skills do you bring outside of your stroke life? And cast your net wide, culturally and linguistically diverse communities if possible. As I mentioned, aphasia, rural, regional, remote, not just people in big cities, because stroke, as we know, happens everywhere. And what life experience, because life experience will be invaluable as well. So the first thing I would say is engage the right people. I've asked for, and I find it really helpful, and I find it's helpful for you guys as well, because you have to think about it. Give me a one-pager so that I can go to my teenage daughter and go, do you understand this? Give me a plan. What are the objectives? What are the roles? What are the responsibilities? Liz worked on one for me for a project that we work on together, and she said that was grueling, but really useful. So yeah, a one-pager. So I know what you expect of me. What's the time horizon? The CRE that I'm on at the moment, I'll be involved with for 5 years, which is great. I like those long-term time horizons. What do you need out of me? What time commitment do you have? And potentially, you've got money and you can pay me, but what other ways, and Liz talked about this also, what other ways besides money can you develop my capacity? Because you guys get involved in research for the outcomes, but also you get to publish papers and you get career progression and stuff like that. For the survivor of stroke, perhaps they have a fractured CV because they spent a long time in hospital and rehabilitation. So what capacity and what development can you add for that member of the team in the same ways that other people in the team are going to get developed if you can't offer money? So yeah, think a bit broader than just money. Think about the stretching and the capacity building for the person with lived experience on your team as well. What's my role? And this again goes back to Liz's pyramid. Am I leading it? I'm using your language. I'm CIB on a research project. CIA might be sitting in the room here with us. But am I providing samples? Am I giving skin and hair and blood or whatever, or am I leading? So what's the role of the survivor, of the person with lived experience? Do you need an advisory group? Are we going to co-design? Are we going to co-present? What are we going to do with it when we finish it? Always keep engaging with me. This is really vital. Before we do the deep dive into whatever the project is, do we actually like each other? Do we get along? Does what's the team dynamics like? Don't build it and then go, oh yeah, by the way, we should engage with somebody with lived experience. Early is best, because that's respectful, and you know, I have to many years I can smell BS a mile away when it comes to engagement. So if you're just ticking a box, don't bother. Um, I joke about do you like pina coladas? So that's a real terrible 70s song, and I was awake at 4:30 in the morning, thinking about the presentation I was going to be giving at a conference. And what I worked out is that you guys, you know, if you know the song, is like it was a guy reading a wanted ad, and she said, you know, do you like pina coladas and walks in the rain? If you're not into yoga, if you have half a brain. And you know, he's working out if the relationship dynamics before they're even in the relationship. And he said, yes, I like pina colada. And it turned out that they decided to meet at a bar called O'Malley's, and we'll plan our escape. And I figured, okay, that crappy 70s song is my gateway into working with researchers, because that had to be. So work out the dynamics of the relationship. Am I the right fit? I might not be the right fit. If I'm 6 months into a 5-year project and I actually want to tap out, nobody wins. So spend that time in getting to know each other. Spend that time doing the relational skills first. I cannot stress this hard enough. Build the relationship before you build the project. Tell people how my contribution have been incorporated. Are you actually listening to me? Check in with me, provide timelines, have regular updates, always stay engaged. As you would with other members of your team, stay engaged with the person with lived experience. Yeah, this one is really like the crux. If you don't get this right, the rest won't flow. If you work with me, and you send me an email on a Monday, understand that you might not get a response till Friday, because I have a job that pays a mortgage and all that kind of stuff. And the research stuff that I do isn't my core business. So how are we going to work together in a way that's going to work for everybody in the team? How often do I have to attend meetings? Do I need support? Do I need meeting preparation time? Do I need materials beforehand? Think about fatigue. Perhaps, you know, schedule meetings in the morning rather than after, you know, 3 o'clock in the afternoon for a person with a brain injury. One of the things that I really appreciate is in all the emails that flow around, at the very top, it might say for me in red, you don't have to read this aid, but you can. I'm like, oh, good. I don't have to. That's just giving me a bit of time back in my day. So spend time working out how it's going to work best. A personal operating manual is kind of like a one pager. I'm Adrian and I like pina coladas. I don't like emails after 3 o'clock and so on. So you get to know a bit about me. And there's a good example on our CRE website. Actually, there's heaps. I don't know why I haven't promoted this before. Heaps of excellent resources on our CRE website. I would strongly encourage you to go and have a look at the ways of working documentation on our CRE website. Power dynamics. This used to be, and Liz talked about it as well. I remember I was in a Zoom meeting with 27 of you guys. Hello, I'm Professor, and I'm Associate Professor, and hello, I'm just a stroke. I'm Adrian. I'm survivor of stroke, and that 27 people introduction really did not sit at all well with me. And at lunchtime, when we came back, because it was a long meeting, I introduced myself as, hello, I'm Adrian, and I am so much more than a survivor of stroke, because it's like, that's reductive. And it used to be, oh, Professor so-and-so and Associate Professor so-and-so. The environment that I'm in these days is lovely because the table's flat. Liz is Liz, Caleb is Caleb, Aid is Aid. This is not to belittle or denigrate the years and years and years of work that you've done to get your professorship. I've done 19 years of lived experience stuff, so there's no academic pathway to Professor of Lived Experience, but I probably am after 19 years. But there's no power imbalance. We all belong at the table and all the voices matter. I've been talking about this, and I want this for my community, people with lived experience, in the same way that you have an academic pathway. You do an undergraduate, and then you do You might do honours, and then you might do a doctorate, and then you might become an associate professor, then you might become a professor. You've got a team around you. You have mentors, you have supervisors, you have lecturers, you have buddies. There's no one like that for us. But there's an opportunity to take somebody on a journey from participant all the way up to lead if we think about how to do it well. So build in the opportunity, the possibility for capacity building for me in the same way that you would build in that early career researcher to get their first, second, third paper and start to get on the path of a research career. Do the same for the person with lived experience. Always have more than one person with lived experience on your team. If they want a mentor, within the CRE, we have a lived experience advisory group, a core, and then a broader group. We can mentor the people on your team. We have research-ready people with lived experience within the CRE lived experience advisory group that can mentor people to help them on their way. And in terms of research liaison, who's my one touch point? Do I go to Liz as CIA, or do I go further down the chain? Just so I know. So I've got that contact, I've got that touch point, I've got that regular communication, I've got that regular check-in with that one buddy of mine. Does your team need training requirements? Have you done the Stroke Foundation modules? Maybe you're really good at research, but you're not so great at talking to people with lived experience. So maybe your team needs some training. I don't know what it might be. Equally, do you want your people with lived experience to be trained? Maybe they need to do some statistics. I don't know. Statistics seems to be the theme of the day, Liz. But is there communication partner training? Is there team building training? I don't know what it might be, but think about, you might need to build in to your project that there's some skill development around how to work together, or for you to have some training around how to work with us. Yeah. Again, on the CRE website, there's some guidelines. Various state organisations have produced good resources. I'm on the board of Health Consumers New South Wales, and they have a really good resource that I use, and it depends upon my, if I'm participating, here's my pay rate here. If I'm Chief Investigator B, here's my pay rate here. It's not about the money. I've got to, I've never got into, a stroke's a good thing to do to earn good money. No, it's not. But this takes time, and as I said, in the same way that you all get paid, it's nice to be recognised for my contribution as well. But it might not be money. I might want gift cards, whatever. I'm thinking preferences. It's just nice. It's nice to be acknowledged, and it's nice for you to think about it. And in doing that, I might need reading and prep time, so I might need a little bit more time than just the hour-long meeting. Whatever it might be, just again, cost it into your project. And as I said, there's on each state, we have a remuneration guideline for each state in Australia on the CRE website. Look, the take home, I really, really want this to be, build those relationships. I want your project to last, and I might not be the right guy for your project. And that's okay. You can tell me that. In the same way that you would tell somebody else in the team, perhaps you're not the right person, or actually you are the right person. We want to communicate early, communicate often, communicate openly, because you want this to work for everybody. So the research can happen on the side, but the relationship building, the communication has to come right at the start and right in the center. I will stop sharing. There we go.
Thanks very much, Adrian. That was terrific, and a lot of key insights there for a lot of people to take home and to learn from. So yeah, thanks so much. We have a a few questions in the Q&A coming through at the moment as well. And thanks so much. I think that Simone has shared the link through to the resources there as well too. I have a question here from Kelvin Hill from the Stroke Foundation. Does the panel suggest specific empathy training be beneficial, as we are essentially talking about how to be a better human being? And does the existing modules cover this enough? What do you reckon about that, Aid?
Yeah, the existing modules don't really cover that enough. We don't touch on, and I'm not aware of specific training, Caleb, that teams might be able to do. But it would be lovely to know that you care that much that you want to do it. So thank you.
That's
And
great.
I'll just say that I think the modules are entry level. They're very, very kind of superficial. I think you can go on 3-day courses on how to do this, whereas our module is a taster. Really, it would take you between 30 minutes and an hour to complete. I think there's loads of support in terms of, I think in terms of it is, we are saying be a better human being about doing this work, but I think it's about being humble and curious and how can we work together. I think it's really important that when you start working with someone, if it's someone you haven't worked with before, is what do we need to do to make this work? How are we going to work together? What do you need? What do I need from you? And having those, they're quite frank discussions in some ways, but also it is very relational. It's very relational. It's about connecting with someone and trying to be productive together and friendly together, as well as and then embed that in processes. So it is about being a better person, but then embedding that into your processes and systems, which, I think can be tricky when you're starting. It can be tricky when you're taken by surprise by something you didn't see coming your way.
Thanks, Liz. I have a question. This might seem like a bit of a no-brainer, but when we talk to people that are maybe a bit novice in engaging people with lived experience, or just generally about partnering with people with lived experience, they say, oh, this is all too hard, or where would I find such people? Have you got any suggestions? They say, oh, I don't know how to approach someone, don't know where to find them. And this is probably quite a particular challenge for those very novice ECRs that might not even have a clinical background or sort of ready access to stroke services, for example. Have you got any advice on, I guess, where to go, how to find, and how to approach people generally as well?
So Enable Me, which is the equivalent of Inform Me for people with lived experience. It's a Stroke Foundation platform. You can contact them. There's an engaged, lively community of survivors of stroke and their broader formal and informal support networks. You can pitch your research on there to an audience that might want to engage. CRE, if you're not already, become an affiliate of the CRE, and get your claws in us. As I said, we've got access to about 30 odd survivors of stroke engaged in our lived experience advisory group. And for early career researchers, sure, it's awkward, but you got to start somewhere. Just ask, as Liz said, with kindness and compassion and curiosity. What's the worst that can come out of it? You get to have a cup of tea with somebody, and you don't need ethics approval for it.
And I think it is. I think if you don't come from a clinical background and you haven't for instance, if you haven't had experience working with someone with stroke, I think that would make it more challenging, more difficult. I think if you come from a clinical background, you're quite used to making connections with people who you don't know quite quickly. You're quite used to on a pretty superficial level, but you become quite quickly at introducing yourself, saying what you want, getting what you want, moving on. And if you don't have that experience, I think it is worth getting, if you're a junior researcher, do you have a supervisor who can support you in that? Because you don't want to go in and do the wrong thing. You don't want to go in and be really abrasive and rude because you didn't know how to do it and you're awkward and you know, I'm like that. If I'm really shy, I'm often quite, you know, I go back and think, oh my God, I wish I'd done that different. So I think if you're really nervous about it, get support, get advice, but then go in with, I think Aid's tips on how to approach is good, but also as someone, like, people will sometimes come to me and say, oh, can I speak to, you know, the people that you work with? And I'm often very protective because I don't want to damage my relationships by someone who I'm not quite sure they're going to go in appropriately, respectfully. So I think that's when you might partner with someone who is doing that sort of work to kind of get ready for that conversation as well. So that's the other thing you can think of is, can you get mentoring how to do it? That's
great. Thanks so much. There are really fantastic tips, I think, particularly for novice researchers. And thanks again to Simone's shared some advice as well in the chat. Professor Shauna Gall has a question in the Q&A as well. And this one, I think it's more towards Aid, but also Liz as well. Interested in the idea of non-financial benefits in terms of skill development and capacity building that might be of interest for people with lived experience through this type of engagement. I know this will vary from person to person, but could you give some examples of what this might be as well? That's a great question. I guess, you know, as you mentioned, there's a clear pathway for researcher development also. So any reflections on what are the needs in terms of skill development and capacity development?
Well, as I said, you know, for me, I was out of the workforce 2.5 months in hospital and 5 months or so of outpatient rehabilitation. It took me about 8-9 months to get back to the workforce, but at least I had a job to go back to, and that's potentially not the trajectory that everybody after a long stint in hospital and then rehabilitation is going to have. So they're going to have a fractured. There's going to be a clear stop in their employment and potentially years before they start again. So, as I said, in terms of capacity building, what transferable skills outside of stroke does this person bring to your research project, and how can you shine a light on them so that they can then potentially put that on their CV that, you know, I've been consulted on asset stroke, for example. So what are their transferable skills outside of their career pathway that's in research that we can cultivate, that we can, as I say, put the focus on so that they start to get some traction and feel some wins outside of their paid employment. That would be one area, Shauna, where I would think, and certainly within a university space, there'd be lots of talented people and that would be helping and be able to help somebody polish their CV in ways that they might not have thought of otherwise.
And I'll just add to that, just from what other colleagues have done. So a woman I know who works in New Zealand offered the people that she was working with, a Maori population, and she offered remuneration, which they didn't want money, but she said, well, what can I do to give back? And they said, we'd like you to come and cook at our barbecue. You know, so on the weekend she went over there and cooked for the barbecue, and that was really important for that community. I think it was about connection and seeing us and accepting us was one thing. And another colleague I've worked with, this was not about capacity building. This was about remunerating in ways that weren't about money. So she is working with a homeless shelter. She was doing a project in palliative care for people that were homeless. I think that's not the right term these days, without a home or something, I think is the proper term. Anyway, she wasn't able to, it was an unfunded project, so she wanted to work with this organization, and so does a whole lot of voluntary work and brings her research skills to that organization to create. She made films as part of her research output, so she was making kind of marketing films to support them with their fundraising activities, and in that way she was then able to work with that organization to be able to put a project together that was a really strong collaborative project about addressing the community need. So I think sometimes if you are unfunded, just speaking to people about, is there anything that I can do for you? Is there anything I can offer you? And you know, certainly there are people who are keen to build their track record and their CV. And so you can say, oh, well, would you like to do some writing here so that I can be your referee about writing? Or, you know, if having a paper is in any way helpful, or doing some public speaking is in any way helpful, and we can do some training on that. Yeah.
Thanks again. We've a little bit more time for any last questions. I have another one that pops up quite regularly, which is around dissemination activities. And so I guess talking with a lot of stroke survivors, sometimes when people are involved in research, they get to the last follow-up phone call or engagement in the project, and they say, okay, bye. And they almost feel quite sad because that's the end of the journey. And we do hear stories of people not finding out about the results as best as they could, or being presented with sort of jargon-heavy scientific papers mailed to them and things. Any sort of creative thoughts on how to share those results back with people with lived experience as well, or things that you've done or that you've seen work, or any cool tips or ways of doing it?
Over to you,
No.
Liz.
I was just going to think that's a reminder for me. I'm not as on that as I should be. Like that's one of the things where I like working with people that keep me honest. It can be a little challenging, but I've had a few reminders going, hey, you said you're going to send us a newsletter this month and we haven't got it. Like making sure that you put reminders in your diary about, you know, put that in like you would a grant deadline. I've said that I'd have the newsletter out by now. Make sure you do it. I think that's so important for you know, that's just being respectful. And I think it's not an excuse. And I know from myself, it's fallen off my list, which is now, that's my learning for me, is I need to put that in my diary to make sure that I do it. I do know some people that do kind of celebratory events, but that's always difficult if you're working interstate. But so that there is that real sense of closure, because I do think when a project finishes, it would be nice to have a celebratory event. That's what I would like to build in, but I haven't always. And when you're working with people from far afield, that does make it more difficult. Over to you, Aid.
I don't know that I could add much other than, I suppose, be clear at the start that there's going to be an endpoint. But we might be friends at the end of that endpoint, so who knows, we might, you know, still have a relationship going forward if we've done it well. So just so long as I know that I'm gonna get let down, but I'm gonna get let down gently, and there might be, you know, potentially future opportunities, who knows, but this comes to an end. I think just like I keep banging on about the communication, be very clear on roles, and that my involvement isn't forever.
No, that's great. There is a comment in the chat from Lisa that maybe just running short on time, wrapping up soon, but she her key question is really around maintaining that relationship, Aid. So that kind of does lead on there about any tips on how to maintain over the years. And we do see these lovely friendships exist with between researchers and people with lived experience across various different projects. Any words of wisdom before we wrap up?
For that comment Lisa has, if it's someone that's in your state, that's the sort of stuff where I would actually say, do you want to come out for coffee? That's just and it, you know, sometimes that might not be appropriate for the relationship you have with that person, but to me, that's an easy way of doing things to just keep touch base with. I often, in some of my work, like I'm setting up they want to call it consumer engagement group within a research network here in the state. And so I will often just try and catch up for coffees with the community advisors, because to me, that's the most comfortable way. I don't want people to have to travel to my university or whatever. So it's just an easy way. So really informal, but that's what I do.
And yeah, look, sometimes the relationship is going to be purely transactional, and that's cool. I'm a big boy, I can deal with that. But it's lovely when it's relational. And I would call Liz a friend. I'd call Caleb a friend. A few people on here whose names I recognise that I'd call friends, because we work well together. And I know that you come with the best of intentions. You've got a career in doing good stuff for people like me. So why shouldn't we get along? You know, I like the relational. Because it leads to better outcomes and you get better quality research as a result. I can do the transactional equally well if you want to do that. But I know what I prefer in terms of what I get out of it. So yeah, just be clear and be honest and open, as Liz says. Yeah, do you want to go and have a coffee? Well, actually, I'm a tea drinker, but sure.
That's a really great point for us to wrap up on as well. I think, yeah, the purposeful coffee is always good. Yeah, absolutely. Just before we do wrap up, I'd like to invite everyone to join me in thanking Adrian and Liz for such a fabulous webinar this afternoon. And a copy of this will be made available via the CRE website as well. Just before people start logging off as well, I have a bit of a quick plug as well to provide. There is a QR code here on the screen that I hope you can see. And this is for our stroke trials workshop on the 18th to 21st of March. And this is a 2-day workshop specifically tailored for early and mid-career researchers around clinical trials in stroke. It's looking like a fantastic session. So there's a QR code there to register your EOI and to keep in touch with us. Unfortunately, registrations are still to be opened, but that's just a link there to express your interest in the session. So I hope that you can join us for that as well. And do, as Aid said as well, do keep in touch with the CRE. There is a process to join as an affiliate, and do feel free to reach out via the Stroke CRE website, via the email to contact us as well. Thanks so much for everyone's participation and engagement today. A special thanks again to Aid and Liz, and enjoy your lunch and the weekend ahead. Thanks so much again. Thank you.
Thanks.